last week it was still like 49 degrees in New York. Ira, let us in on that.
Well, now it's like 70 degrees. It's beautiful outside. People are out on the streets. It's amazing.
Where are you located?
I'm in New York.
Okay.
I live right by Grand Central, actually, right by the.
Oh, no kidding.
Yeah.
All right, cool. Very cool. Big city.
Yes.
All right, so we'll go ahead and get started. A couple things are happening today. So today is our official launch of the EBCBA Odyssey. We've got our founders call. So if you completed the founders course, the foundation course rather, that unlocks the founders call, that's our free path. So if you want to get on that bus and ride the free bus all the way through the blueprint, we're going to be going through all of the blueprint courses, and basically lesson by lesson on each phone call. And that's the free path. So if you want to build your business slowly and build that out, you can do that by completing the foundation course and then attending the founders calls every week. Also, we have our first Odyssey call. That's our members only 2-hour workshop Thursday night, 7 o'clock to 9 o'clock Eastern Standard Time. That gives everybody on the East Coast and the West Coast time to join after work and show up with your pile of work that you're trying to work out. And that's where we'll all collaborate and work on it as you're going through the Blueprint series, or even after you're done with it, you start doing deep dives on the other courses. So we've got both of those things today. It's our first day of our official launch, our start of Founders Month. And then another quick announcement is we are launching the app. So we're hoping that the app will be launched by the end of May. We're just waiting on approvals from Google Play Store and Apple iTunes. So that'll be awesome because you can carry everything around in your pocket on your phone. So that'll be great. Alpaca Health has an extremely valuable offer. They are focused on the small to medium-sized ABA companies who are wanting to get themselves established, run their own business with their own name and have their own identity and do things their way, and kind of push off all the administrative billing and the contracting and the credentialing and all that, and not have to deal with as much of the back end that takes up so much of your time as an ABA owner, and can cause mistakes and cash flow issues. So Alpaca Health has a great gap that they're filling for a lot of ABA owners, and we're honored to have Michael Goo, their CEO, here with us today. And this is our second live stream with the theme, you've started an ABA practice, what now, right? What do we do after, right? And we're going to get in a little bit deeper today on a couple different topics, and really excited to hear more. But I learned a lot in the first live stream. I always love doing live streams where I'm learning something about the ABA business, and happy to have a great instructor here in Michael. So Michael, welcome, sir.
Thanks so much, and thanks for having me again. I'm going to share my screen. I'm going to talk through some tips and tricks that we've gotten from helping ABA businesses scale from nothing to your first client and your first client to your first caseload. And so before we get in too far, maybe quick introduction about myself and the company. So my name is Michael. I'm one of the founders here at Alpaca Health. And before this, I worked in the world of education. I built a very small education tutoring company focused on one-on-one individualized supports with all students, but particularly a student of special needs population, where I came across the world of ABA for the first time. Before this, I was in the world of technology as well, along with my co-founder Bao. And so we both have seen a lot of people start businesses, both our friends, our family members, his dad, my grandpa. And so we come at this really dedicated to serving entrepreneurs, small business, and small practice owners. At Alpaca, we empower BCBAs to start, run, and grow their own independent ABA practices. And the reason why we're working so hard on Alpaca is because we think that the future of ABA and the future of healthcare should belong to clinicians and not the big box corporate ABA chains that are trying to take over this industry. I hear time and time again where there are minimum hours requirements, there are productivity quotas that don't make sense. There are all of these things that make sense from a financial and maybe even operational point of view, but don't make sense from a clinical point of view. And I think the answer to that is small, independent, clinically minded, BCBA-led ABA organizations taking the reins of this industry to make sure that we are maintaining a focus on quality and clinical delivery over the finances, quality over quantity. And so our mission is really to help clinicians and BCBAs become owners of their finances, which means that you should get paid for the work that you do. And if you do more work, you should get paid more. You should own your time. If you have a master's degree or higher, your time is highly valuable, and it shouldn't be spent doing, honestly, not master's degree level things like credentialing, like admin work, like billing, like waiting on hold with insurance. There's so much need out there. We need you working with kids, not paperwork. And the last thing is you should be able to decide what is right for your family and your clients, period. Operational, financial considerations shouldn't stand in the way between you and your client and quality service delivery. And so the way Alpaca helps clinicians become owners is we take on all of the stressful, non-clinical administrative tasks that you have to do. We offer all-in-one AI EHR, data collection, scheduling, payroll, intake, so that you never have to do things like session notes again. We do all the admin for you. So if you've started your practice, you're probably doing verification of benefits call, monthly eligibility checks, prior authorizations, all of that we do for you. And then last but not least, we make sure you get paid. Insurance notoriously can take 6 to 8 or more weeks to actually pay you for services rendered. We make sure you're paid every 2 weeks so you can always pay your staff so that you don't have the stress of the financial piece of starting and running a business. And so we're going to start there. We're going to start, today's webinar is going to be focused about how you can grow your practice, but do it sustainably. At this point, you might have already gotten your first 1 or 2 clients, and now you're thinking, okay, I have my first BT, how do I hire a second one? How do I hire maybe another BCBA? How do I do so sustainably, focused on quality, focused on operational excellence, unlike the big box ABA companies that scale without having figured out good systems and good processes. And so we're going to cover 3 main topics today. First is dealing with the cash flow issues of growing your practice. The second is how to deal with client cancellations and scheduling in a scalable way. And the last is getting your technology and data systems all in order. But first and foremost on cash flow. If you are growing your business, this will become an increasing problem for you. It's a very boring topic, cash flow, but it's the thing that makes everything work. It's the way that your business runs. It's the way that you get fed. And most importantly, your staff get fed. In an ideal world, in most businesses, once you deliver a service or sell a good, you get money. We all know that's not how insurance works. When you deliver a service, you have to wait 6 to 8 to more weeks for insurance to pay you. And that lag time can be devastating for small practices who haven't thought through their cash flow strategy. Why is that? Well, when you deliver services today, you have to pay your staff in 2 weeks, even if insurance takes a lot longer to pay you back. That's compounded if you're growing your practice. So maybe this week you're doing 20 hours. It's not that much. You're paying your BTs out, maybe $22 an hour. If insurance doesn't pay you back instantly, it's probably okay. But maybe suddenly the next week you expand to 60 hours a week. Well, now that 20 hours that you have just paid out to your BTs with the expectation of getting it paid back later, that's just tripled in size. And you might not have the cash in the bank since, again, insurance hasn't paid you yet. And so as a small practice, you certainly deal with this problem as well. But when you're growing and rapidly bringing on clients and staff member, this can cause an even greater gap in your cash flow. And so at this point, many practices start looking to other financial instruments to bridge these gaps in insurance payment. Before we get into those options, I do think one thing that is actually purpose-built in the system of insurance to help you deal with this cash flow issue is patient responsibility, copays, and coinsurance. If you think about going to your primary care doctor, a specialist, when you go to the front desk and you sign up, you don't just confirm that you're there, you pay your copay before you even see the doctor. And that lets that practice run efficiently because that copay will help them pay for the medical assistant, the space, the overhead needed to run that practice. And then eventually once insurance reimburses them the rest, that's when they'll make their profit. So that coinsurance, that copay is actually meant to help you get cash up front and deal with the issues of this cash flow gap. Most ABA practices do not collect patient responsibility at the time of service. And in many cases, that is a good thing. You don't really want your RBT to have to collect a payment from a family. It causes a strange tension in the therapeutic relationship. You probably also don't want to give all of your RBTs credit card scanners. There's a lot of reasons why that isn't the case, at least in-home ABA. But then, and this is the piece that I see a lot that is incredible to me that this continues to happen, is clinics that just don't collect patient responsibility or collect patient responsibility once every 6 months, even sometimes once every year, and expect to get it paid. That's, I think, a huge problem with in-home ABA practices and a reason why many of them experience this cash flow issue. And so a couple of different solutions here and frameworks for thinking about patient responsibility. First and foremost, be proactive about telling your patients about patient responsibility. At the time of intake, you should be letting your patients know how much they should expect to pay every week, every 2 weeks for services rendered. You should tell them what their deductible is, what their copay is, what their coinsurance is. Tell them what those terms mean. What is a copay? What is a deductible? And then also translate that to them on a how much you need to pay every week basis. Oftentimes, I see patients being blindsided because nobody sat them down and explained to them their insurance benefits. Ideally, it's something that everybody knows, but we know that that's not the reality of healthcare. It's complicated, it's confusing, and as practice owners, we need to step up and give that financial guidance to our clients at the time of intake, so that when they are actually starting to see you, when you give them an invoice, it's not surprising. It's clear. The expectations are set from the get-go about how much they need to pay. We see practices delivering invoices at all random kinds of time. Consistency matters. If you tell them you're going to send an invoice every 2 weeks, actually send them an invoice every 2 weeks. And that gets everybody in the habit of actually paying that patient responsibility, which can be the first payment you get, even when insurance is delayed. There's great technology for this. There are other technology solutions that create a patient portal for patient responsibility that allow patients to easily pay on their mobile device, to pay with credit card, to have financing options. Collectedly is a company like that. Cedar is another. These are great technology companies that work with all types of healthcare practices. The problem is that as a small practice, it introduces yet another piece of technology and yet another piece of technology that parents are using. Your practice management system may already have a parent portal where they're tracking data, session notes. You may have some internal parent training resources, and then you're adding on a financial platform for parents. If you think multiple platforms overwhelms your staff, where this is their job, imagine how it can overwhelm a client where this is something that's supposed to be easy for their family to navigate. So that's why I really push everybody we work with to think about how you can bring everything together in one technology platform. At Alpaca, we're actually developing our own patient responsibility feature as a part of our parent portal so that everything is all in one and integrated. The upshot, though, is if you are growing and you're worried about paying the bills on time, do not forget about patient responsibility. Build that often, and create a relationship with your patients where talking about finances isn't taboo. Now, that may not be enough depending on your situation. You may need to go one step further and actually explore financing options off of incoming insurance reimbursements. Some practices choose to do this without financing and just add personal resources and dollars into the business, knowing that they're going to come back eventually after insurance pays. But while that is the easiest process, no approval, certainly no interest, there is risk in this. First of all, it continues to mix your business and your personal finances. If there's any sort of lawsuit like that, lawyers will try to get rid of the limited liability shield that your business entity provides, because they're saying that it's not a business. You basically use personal money and put it into the business many, many times. So the business doesn't actually get limited liability. That can be one legal risk of mixing your business and personal finances. And of course, it just increases your financial risk because now you're putting more and more money into the business and you get it back if insurance reimburses you. But oftentimes that is a significant and big if. There are other financing options out there. You could get a flexible line of credit. What that means is the bank allows you to draw up to, let's say, $100,000. If you draw on it, only when you draw on it do you start having interest accrue. The interest doesn't need to be paid immediately. It'll grow over time if you don't pay it off, but it's very flexible. You don't have to pay off your line of credit on any fixed set schedule. The problem is a business line of credit, because it's so flexible, often has a slightly higher interest rate. It can be difficult for new practices to obtain a line of credit if you don't have a strong history of bank statements that show money coming in. And it is almost certain that you're going to need to do a personal guarantee, which again increases the risk factor that you're putting on yourself. Now, the other option that's specific to healthcare is healthcare lenders that give you immediate cash based off the claims that you send. This actually means that there's no debt on your balance sheet, because what factoring companies do is they actually buy the claim for you and pay you some percentage amount of the claim immediately. That being said, fees are often quite high in these cases, between 5 to 15, I've even seen more percent of the claim, and all they're doing is the financing piece of it, nothing else. The paperwork here can be highly complex. You often need to give the healthcare lender access to your bank accounts. You need to send all your EOBs to a shared mailbox so that the lender can look at why there are denials. And the lender can easily stop factoring your claims if there are denials downstream. These factoring companies tend not to be the greatest partners, and you can tell that by how much they're charging. And so these are options. None of them are that great, but they have been the way that ABA practices have grown for forever. This is the way that it's traditionally been done. At Alpaca, we want to do something different. We want to help practices launch and grow without having to deal with these onerous financing options that you as a clinician probably don't fully understand anyways. So at Alpaca, what we do, in addition to providing you technology and managing the entire back office of your practice, is that we pay you every 2 weeks a huge percentage of the insurance reimbursable amount. The way we do that is by credentialing you under our group contract, so we are the ones submitting the claim. Every 2 weeks, for all the claims that we submit for your practice's behalf, we will pay you a huge part of the insurance reimbursable amount. So you'll always be able to pay the bills, pay your staff, pay yourself. And then once insurance reimburses us, we eventually get paid. We get paid last, and we only get paid if insurance reimburses us. That's what makes us so dedicated to making sure our technology and our processes lead to compliant service delivery and billing, because if we don't, then we not just not get paid, we lose money because we've already paid the money to you. And so this is an option that lets you have consistent, guaranteed income, but also gives you a real partner with skin in the game, unlike solutions like factoring, where they're just an outside lender charging you really high fees. So that's cash flow. The second big topic I wanted to talk about that's huge among practices of ours that are growing from one client to a full caseload to beyond is scheduling. Once you start having more staff, more clients, there just naturally are going to be more places where people cancel or need to reschedule. So what can you do to solve this problem? The first is getting clear on communication. Too many times, BTs are giving out their personal text messages, creating a one-on-one chat with their parents, and that means that you as a practice owner actually has no idea what is going on. You might have a one-on-one thread between you and the parent, a one-on-one thread between the BT and the parent, and then maybe a group chat with the three of you, and maybe an email chain between the parent and the company address that's not linked to your email or anybody else's email. It just sounds confusing. It is confusing. And so what we recommend to our practices is establishing one official channel for all scheduling communications, one channel for all communications to all staff. Instead of the parent texting 3 numbers, the parent texts 1 company number and everybody has access to it. It creates transparent visibility for you as a practice owner. And it also helps your staff know what's going on the scheduling front as well. And Alpaca, our technology system, it actually has an all-in-one texting platform for our practices to use. So instead of having to get yet another software solution like a dial pad or a text line, it's embedded in our platform, and you're not only able to communicate with your clients and families this way, you're also able to see context on the clinical side about the practice. So when was their last appointment? When's their next appointment? All of this information that's obviously helpful when communicating to parents. Now, once you've established this all-in-one type of communication, like the one that the Alpaca Health technology platform has, the question is, what processes are you going to build around a client reschedule or a client cancellation? A couple of notes here and ideas to think about when you're considering how to decrease the number of reschedules and cancellations. First is when a BT says they're calling out or a client says they're calling out, you don't just have to say yes. You can try to negotiate an alternative solution. So for instance, if the BT says, hey, I can't make it today, I'm going to the doctor. Instead of canceling the appointment, can you push the appointment back a few hours? Instead of the client totally canceling out because they are out of town or because of some other personal reason, can you provide an alternative solution? Telehealth, a shorter session, a more focused session, so that you can continue delivering good quality therapy and also maintaining utilization. Obviously, sometimes this is not appropriate. For instance, if a client is sick, if there's been a major life change in a family's life and they just need time to themselves, everything needs to be filtered through a clinical lens for quality assurance. But from an operational perspective, instead of just taking every cancellation at face value, think about ways that you can find creative and alternate solutions so that everybody can still get their hours in. This is ultimately about quality, because we know that if clients are not getting the number of hours that we think is clinically recommended, they're not going to get better. And what that means operationally is that at the next time you have your treatment plan, writing that reassessment is going to be very difficult because you're going to have to talk about why the scheduled sessions didn't actually happen and why progress wasn't as significant as we might have expected originally. Once you have this conversation with parents about or staff about what time they could do, you need to notify the other side, the BT or the client, immediately and then reschedule promptly. You don't want these rescheduling threads to linger over many, many days. You want a fast resolution. Otherwise, people are just going to become non-responsive. You might consider having a floater BT or a BT who joins your team and you give full-time hours to, that's like a lead RBT, does some non-clinical stuff, but can take entire sessions to maintain continuity. You might also consider having BTs, if they can't make the full session, just do a part of it. These are all things that you can do to try to maintain utilization with the assigned BT or with subs. And the last piece is the only way you know this is working is if you're tracking these metrics. You're tracking metrics around utilization, scheduling, rescheduling as the client or the provider doing the cancellations. Most modern platforms have some way for you to track it. Few have dashboarding and analytics so that you can understand what's going on with your business. And that's something that our Alpaca Health technology was built to solve. How do you handle staff callouts in particular? One of the things that we recommend our practices do is create a list of trained and identified substitutes. You don't just want to put a BT fresh with a new kid with new training. That is almost certainly a bad idea from a clinical perspective. You also probably want multiple BTs per kid so that you have some element of generalization. And so you want to create this crosswalk of client, assigned staff, and also list of approved substitutions. And you want to have that list not in the moment, but from the get-go so that you understand when a scheduling situation happens, who to reach out to potentially sub in. Rescheduling can move really, really quick. If a session is at 1 p.m. today, it's already 10:30, you need to move very, very fast. So you don't want to be thinking, oh, who can be a good fit for this client? You just want that list of trained substitutes ready to go when the situation happens. And then the last piece is if a staff is trying to call out, you can always try to reschedule. I would say parents' schedules are often more flexible than they make it out to be. And so if a staff needs to cancel the morning sessions, see if they can actually meet in the afternoon instead. It's a difficult process because you have to talk to the staff, you have to talk to the client, you might have to pull in other substitute staff and check on them, then you have to get the client's final approval to see if a substitution can finally happen. But this is the type of operational process and discipline that if you get right as you're growing your practice, you'll have a truly excellent practice where clients are actually getting the number of hours that you recommended and that they need. Because it's so difficult, we've created a feature of our technology called the AI Rescheduler, where anytime this happens, it's actually an AI agent communicating with all of these different parties. This is a clear process. It's templated. You define it. There's no reason why you need to be the one executing it. You need to be the one remembering to follow up with the parent to see if they actually do need to reschedule. You don't need to be the one following up with potential substitution appointments to see if they can make it. An AI agent can. And that's what we're building, a dashboard where you can see the number of reschedule requests, the number of successful matches, how long it takes to reschedule a match, all the rescheduling requests that are happening, their current status, and also a clear activity log of exactly what our AI rescheduler has been doing. Last topic I want to cover today is manual data entry that was okay when you were working with a couple of clients, but will become increasingly difficult as you scale the number of clients and staff that your practice has. I think the primary way, the two places where this happens the most are billing. I take a scheduling export and then bill it. And then number two is payroll. I take a scheduling export and then send it to the payroll software to use. And the risk of that is a human is going to make a mistake. And it's not out of bad intention. It's not because they're incompetent. And it's just because humans make mistake when doing mundane, rote things over and over and over and over again. It's also risky because it takes a lot of time. It was, again, probably okay that a practice with a couple of clients manually enter data from one system to another. Maybe it took you an hour a week, but if you double the size of your practice, it'll take at least 2 hours, if not more, then 3 hours, then 4 hours, and you just don't have that amount of time. And if you hire someone else to do it, then it starts costing your practice money. And so you want to eliminate that extra time and the financial impact of having to hire someone else into the time that they take. Last piece to talk about here is burnout. It is very easy to burn out when you're doing repetitive, rote things over and over again that aren't creative, that don't use your brain. And so you want to find staff to do really impactful, creative things, because that's the type of work they're going to like the most, versus things like data entry, which are boring and mundane. And so I really push practices to ask themselves, do I actually need a spreadsheet export? Do I need to create a new spreadsheet for myself? Because every manual data entry, every spreadsheet, you do it in the moment and it feels okay, but then it becomes a spreadsheet and a process that you need to continue doing over time, that you need to maintain, that you need to find someone else to maintain, that you need to be able to connect to the other spreadsheets that you're building. And suddenly you have a practice management system, 8 spreadsheets, they're duplicating information. You never know where the source of truth is. And so it is very easy to say, let me solve this problem by making a spreadsheet. It feels great to make the spreadsheet. It feels really, really organized. But then there are consequences in the aftermath of creating that spreadsheet. And so instead of let's create a spreadsheet, I push practices to think about how they can use their existing technology solutions to foot the bill. Even if your spreadsheet is 5% better than the existing technology, I think that you should still use the integrated technology solution at your practice so that you don't have to maintain and manually maintain this other spreadsheet. And so the question is, how can I find an integrated technology solution that actually works for me? A couple of ideas. So the first is, I think practices have a lot of items on their wish list, but what are the core needs you have? Maybe you just don't have that many client callouts, and so scheduling isn't a huge problem. Maybe you have a whole bunch of student analysts where data collection, regardless of the platform, is going to be straightforward. Maybe you only bill Medicaid, and it's actually pretty simple. No modifiers, pay once a week, it's fine. What are your most essential needs? What are the things that your practice struggles with the most? And I can almost guarantee you there's going to be one that stands out. Every practice thinks they need everything, but most practices really should prioritize in improving one part of their business at one time. From there, decide whether you want a software platform or a services partner. And I think this is a very important distinction. There are a whole bunch of software platforms out there that will charge you a per user seat, that will give you technology, maybe train you, maybe not, and let you use the technology. And this can work out. You can hire people who learn the technology, who maintain the technology, who add and edit information in the technology. But ultimately, that means that you have to be the one responsible for hiring staff, teaching them how to use the technology, and creating business processes around maintaining the information in the technology. That is a lot of non-clinical operational work that maybe you as a BCBA don't want to do. You started your practice to serve clients, and now you're thinking about spreadsheets. And so I'm obviously a little biased, but I think that's why a services partner that not just provides you technology, but fully just does the job to be done can be an excellent choice for clinicians who want to grow their businesses without having to get into the weeds of every one of these administrative functions. Most classic version of a managed admin services is a biller that comes in and maybe provides billing software for you to see the claims, but also that does the billing for you. That's the most popular version, but there are solutions out there that'll fully take over your intake, your scheduling, your patient responsibility collection, and you can either piecemeal all of those different software plus managed services solutions together, or you can partner with Alpaca's all-in-one that provides you all-in-one technology and all-in-one services. In every good evaluation process for new software, new vendors, every team member is involved. Before I let a practice sign up with us, I make them get the whole team represented. The BCBAs on staff, the BTs on staff, and sometimes even a parent to give feedback on the parent portal. You want to make sure that you're getting feedback from the people who use the system daily, not just you, because you're going to be using the system slightly differently than your techs do, than your student analysts do, than your parents and clients will as well. And then the last piece is consider training and customer service. The reality is every piece of software can be improved and further customized and tailored to your practice. No software is going to be perfect, not even ours. And so what matters less is where the software is starting and more about your belief and conviction that they'll adapt to your needs, that they'll grow with you. If you're rapidly growing, what you need today is going to look very, very different from what you're going to need from 3 months from now. And so are you working with a software solution that will grow with you or that will remain stagnant? Maybe you find a software solution that's the perfect fit today, but you know they're a legacy vendor who's not going to add new features, not going to give you the time of day to talk about customizations. And so when your business looks really different 3 months from now, you're going to have to do something different. And so I think this is the reason why a lot of small practices have a problem with a practice like CentralReach. It is just so overbuilt. There's so many different features and bells and whistles that small practices don't need. And the things that small practices do need, CentralReach is unresponsive to those requests. So evaluate the partner that you're getting into a relationship with. Are they someone who responds? Are they someone who has good customer service? Are they someone who, when you tell them to build something, they'll actually do it? I think that's a really important quality small practices need. An example of how Alpaca has thought about this problem is how we think about scheduling, billing, and payroll. This seems very obvious to me, but your schedule is the single source of truth about the time that your staff is spending. That's necessary for billing. The start and end time of all billable appointments need to be turned into claims for submission to a clearinghouse. And the schedule is also the source of truth for your payroll. Export out the time you spend driving, the time you spend in sessions. That's your payroll. And so I don't know the answer to this, but why are technology platforms that do scheduling not also doing billing and payroll? It seems so obvious. You have the start and end time of every single thing that your staff has done in your scheduling system. So you push that over to payroll, you push that over to billing, and then you're done with it. That is at least what Alpaca does for payroll. You click export here on this page, and it runs your payroll, takes out your state taxes, takes out your federal taxes, pays those taxes, does all state filings, sends out pay stubs, all because we already have the data needed to do those things in our scheduling module. Cool. So maybe to kind of summarize the 3 things we talked about, as a growing practice, one thing you may consider is cash flow. How are you going to do with these long payment delays from insurance while you're growing and growing and growing your practice, which increases the amount of cash you need to pay out to your BTs every pay cycle, even if insurance takes longer? How can you build scheduling processes, find the right scheduling technology to help you improve utilization? And the last piece is, how can you stop yourself from needing to hire an admin team member for as long as possible, because you're not just adding spreadsheets, you're thinking about processes and the right technology partner to help get you to the next level. That's it. That's the presentation. Again, my name is Michael. I'm one of the founders at Alpaca Health. We're a business in a box, a practice in a box for BCBAs who are launching their practices, who are running their practices, and who are trying to grow their practices. This is my contact information. This is a QR code that you can scan to find some time on my calendar and learn more about the work that Alpaca does with BCBA-owned practices. Would love to meet with you one-on-one, and if there's any questions in the meantime, happy to take them here.
Well, I learned something on just about every live stream. The thing that I'm excited about the most with your software platform is the fact that the scheduling and the billing are late.
Yes.
No transfers or double data entry. Like, that's a beautiful thing. And you're also eliminating the human error, right? Like, there's less opportunities for somebody to make a typo or
Yes.
click something wrong, right? So that's always a beautiful thing. And the integrated text is huge. Being able to have, HIPAA compliant texting with the parents. I mean, the parents don't want to email; they want to text, and it's really a great thing. The car dealership is texting me right now about my service appointment. Like, this is stuff that really works for people and definitely helps with scheduling. Will definitely help with cancellations, and yeah, that's all really great stuff. So y'all definitely check out Alpaca Health. Even if you're already operating and you're looking to offload some of this stuff, like, this is not just for startups. They can help you get your business back on track and get rid of some of this administrative work on the back end. So whether you're starting up or you're just trying to get control over your business again and looking for a change, check out Alpaca Health. Thank you, everybody. We'll see you on the next one. Michael, once again, thank you, sir.
Thanks, everyone. Bye.